I'm Dr. Jennifer Hall. I'm an ankle and foot surgeon with the Iowa Clinic. Frequently, we're seeing patients in clinic with complaints of arthritis or generalized pain within the ankle, issues with chronic ankle injuries or instability. A lot of times these are diagnosed as lateral ankle instability, sometimes Achilles tendonitis, or chronic arthritis and pain to the ankle joint. We see a variety of patients, from the average day-to-day person who's increasing activity for exercise, all the way up to recreational athletics and college and additional more intense sports activities. Frequently during an initial evaluation for ankle pain in general, we start with conservative treatments including anti-inflammatory medications, rest, ice, compression. Sometimes we'll add in physical therapy if it's been more of a recurrent issue. And sometimes we end up doing a Kiam boot as well, just to stabilize and provide decreased pain in the short term. With an acute ankle related injury, we typically will start with radiographs or x-rays and evaluate the situation from there. If advanced imaging is required, we can proceed with that. Once we have a good visual on the actual trauma, we can proceed with surgical intervention as needed. If surgery is required, we will work with your primary care physician to obtain preoperative clearance. Surgical procedures typically require general anesthesia and can last anywhere from half an hour to 45 minutes up to about an hour and a half. Post-surgical recovery times vary dependent on the type of injury as well as severity. You can expect approximately 4 months for a complete recovery, where we're really starting to return to activity as previous to the injury. During that recovery period, we'll work closely with your primary care physician, physical therapy, and any other teams that are necessary to help you rehab as efficiently and effectively as possible. When it's not an acute injury and you're experiencing pain or issues with instability, chronic ankle rolling, or other generalized discomfort, it's important to come in and be evaluated. We can help diagnose a lot of different issues that may be able to be treated conservatively or surgically if necessary in the future. Whether or not you have a history of ankle issues or pain, a few things that may help prevent an injury in the future would include strengthening, stretching, and making sure to be in a good supportive shoe.